Welcome to True Health Tuesday, and the truth will set you free. Even though the truth is 3 minutes late, and don't think that bugs me. Okay, headaches and migraines, causes and solutions. On the censored aspect, we're going to talk about ignorance. Ignorance is the real epidemic. But I like this quote here. Quarantine is when you restrict the movement of sick people. Tyranny is when you restrict the movement of healthy people. Yeah, have you been to LA yet? Okay, so all of this information, and we have been shadow banned, we have been demonetized, we have been, deleted a lot of videos off of YouTube. Please help us sign into Dr. BVIP. Share this as much as you can, because the information, I'm trying to keep it where the censors are going to allow it, but it's getting spicy out there. We're also, all of this is on Odyssey, on the BitChute. So get out there. If you see it, share it. This week, this is the total for so far. 1, 2, 3, 4, 5, 6, 7 videos in the last 2 weeks have been deleted. So you can't find them on YouTube or Facebook anymore. Okay, you can find them on the Dr. BVIP. But what's interesting is these videos have been up, some of them for 2, 3, 4 years. Okay, and the community was okay with it. In fact, if you're looking at the thumbs up, of course you can't see that anymore, but you're talking about 95 to 98% of all the comments were positive. So I don't know what community I'm pissing off. So let's get into this. So just know that when people talk about censorship, baby, it's there. So let's look at headaches. Anybody feel that headaches are medication deficiency syndrome? No? Okay, so let's look at how stupid this world is. Okay, and I'm not talking about, covering your face or, taking a mask off when you sit down to eat and putting it on when you stand up and then taking it off when you put in the car. And I'm not talking about that insanity. Okay, do you think that if you have a symptom, you should take a chemical to alter your physiology? Or is that symptom an intelligent response telling you that there's a problem? Okay, well, let's look at headaches. Okay, 93% are coming from the neck. So should you fix the neck or take a drug that's poisonous? I mean, it seems like too common sense. It seems like, your grandma and grandpa would be saying the same thing, and that's true. Now, that means that if you alter your nerve supply, okay, you have a problem in the neck, trauma in the past or anything. Now, has anyone ever had an arm fall asleep? No kidding. Yeah, every guy in here. Because if your arm's around your girl and it falls asleep, you ain't moving that, right? Give me an amen. Of course, when it comes back, what's it feel like? It's all pins and needly. That's because when you compromise the nerve, it gets more sensitive. So when you compromise the nerves that supply the mucous membranes and the sinuses, they can get more sensitive. Does that make sense? And so about 7% are from alcohol, toxicities, dehydration. Dehydration is one of the biggest ones. And then there's medication overuse, headache. So we're talking a very, very 1/10 of 1% is going to be tumors or cysts. But those tumors generally are coming from some predisposing injury. Like we see a lot of tumors, a lot of brain cysts from subdural hematomas where there was an old injury in the past, loss of curve in the neck where pressure is building up inside of the head. So find the source. Now, what's interesting is when we look at the neck, a normal neck should have a curve. Okay, when we're looking at loss of curve, and you're going to see on the right side, it's not exactly normal, but it's more normal than the one on the left. This gal, gymnastics, you're talking a ganglion nerve block. I mean, this, again, it drives me nuts. Can you imagine carpal tunnel syndrome, which is a double crush injury beginning in the neck, and headaches, which come from the neck? And somebody wants to do a ganglion nerve root block, and this is a part of the nerve that's exiting the spine. So they're going to shove a needle in there without correcting it. So you have an entire profession that doesn't know how to restore the curve in the neck to fix the problem. Mind-blowing. So let's go over a couple of types of headaches. Now, we're going to go over these in detail. We got sinus headaches, migraine headaches, cervicogenic headaches, eye strain headaches, stress headaches, allergy headaches, insomnia headaches, poisoning headaches. Okay, we're going to look at all of those, okay, in pretty clear detail so you can identify. How many people want to start with sinus? Baby! Okay, now I used to have headaches so bad when I was a kid that I would just want to beat my head. I would just like drive it in and put all this pressure on. And now that I know, when I was like 12 and 13 years old, I know that it was a sinus headache. So how you identify if it is a sinus headache, you put one hand on the back, one hand on the front, and squeeze it together, okay? Now, when you do this, if it feels worse or better, you're doing okay, because the sinuses are behind here and they're trying to break out. So you're just creating a counter pressure. Now, if you ever get a chance to look at a skull, right in the middle of your eye socket here, there's a nerve. Right below it, there's a nerve. And right here, there's a nerve. So if you're putting pressure and you're putting it right over the eye and it hurts, yeah, you're putting pressure on the nerve. So just avoid those nerves. But when you apply pressure, you're creating an intermittent force loading, which increases and decreases the pressure in the sinuses, and they start to drain. And we've got 6 sinuses up there. To get adjusted means that you get the nerve adjusted, but also we do facial and cranial adjusting. And it's a trip, because if you've had chronic sinusitis, you're going to actually see some of the bones actually distort and change in shape. So we'll actually go in there inside of the mouth and open up the roof of the mouth to get pressure off of these maxillary sinuses and the ethmoid sinuses. I mean, it's amazing. Now, people will say, remember, and I'm talking to the people that drug you instead of looking for the problem. They're called more drug doctors. Facial bones are all fused. You can't move them. Okay, let me show you how you can talk to these people. Take your finger, rest it right on the bridge of the nose, and have it touch this little bone up here. So just rest it there. Unless you have glasses, don't do it. Okay, so then push up with your tongue on the hard part of your mouth and relax. Up and relax, up and relax. So you're moving that hard part. So push up and then relax. Feel it move? Yeah, there you go. Facial bones move. They don't fuse. And there's a lot of skull work that we'll do too to get pressure off of that. Spicy foods, such as cayenne supplements, an amazing vasodilator. It thins the mucus. It's fantastic. Fresh pineapple, amazing. It has bromelain in there. It just drains it. Steam, spicy foods. You can even give yourself a reverse ice cream headache. Have you ever had like Slurpee or something and you get that massive pain over the top? Okay, that's because you're freezing out the soft palate in the back, and that's attached to the sphenoid bone that's right behind the eyes. You can do the reversal by getting hot water and just holding it in your mouth. That'll heat up the sinuses. It'll relax the soft palate. There's tons of things that you can do. Then you notice I'm not saying an antihistamine. Why would I say it? Because antihistamines are linked to brain damage and a couple of other things. Now, here's one, pain over the eye. And this is a referred trigger point headache. And people will say, man, it's right here. Okay, so now there's a couple of things. The referred trigger point headache is actually coming from the neck. But let's say that you've got this headache and you've got to complete the task. You've got to drive to the job site, or you've got to, take the test, or whatever task you have to do. So halfway in between the shoulder and the neck area, I got a microphone here, so I'm going to try and do it without screwing up the microphone. Okay, is that screwing it up? Okay, so I'm going to use this side. Halfway between the shoulder and the neck, if you put your hand there, you're going to feel like a golf ball if you have this headache. And it's going to be ipsilateral, so the same side. So if you're on the left side, and this is my left side here, and you're grabbing it and you're pulling this down, that will decrease that pressure. You'll feel a golf ball. Or you can just lift your head up, like put your elbows on a counter, lift it up, and that will decrease the stress there as well. And you only got to put pressure on there for about 30, 40 seconds. Now, when we're looking at muscles, a lot of people are going to say, wow, forward head carriage, thoracic outlet, you could do a lot of work on the muscles. You could relax them and everything else. The muscles that run down either side of the spine, they're not under conscious control. They're called postural muscles. They're under proprioceptive control. So the further your head goes forward, for every 1 inch forward head carriage, the pressure on the disc double. That means these shoulder muscles and neck muscles are going to be screaming to try and reposition it. So the way that you want to relax those muscles is take away the reason they're firing. Okay, and this is where you're going to do the neck curve exercise that we're going to cover, but you just put your elbows on a counter, lift up, and deep breathe. Just know that those muscles are tight for a reason. Never, ever, ever, ever. It's like 4 evers. So I must be serious. Okay, relax the muscle unless you know why it's firing. Okay, does that make sense? Now, all of this stuff leads to an autonomic dysfunction. So, and this is why it drives me crazy. So if somebody has a headache, man, that puts you in a stress state. No one's going to have a headache and say, God, I feel all relaxed. No. So it's a sympathetic dominant or fight or flight state they're going to be in. You got that automatic nervous system, rest, digest, and repair. Now, the rest, digest, and repair, that parasympathetic nervous system is located in the neck and the pelvis. So you have an alteration of function. You can have an alteration of how your body is regenerating itself. So this is huge. So when you restore that curve, you're going to start to get out of that stress state. Now, what happens when you're in a chronic stress state? You're misdiagnosed with high blood pressure. You're misdiagnosed with inflammatory bowel disease. You're misdiagnosed with high cholesterol. You're misdiagnosed with type 2 diabetes. Those are all adaptations to stress. Now, we are living in a culture where people will give you toxic chemicals that have a negative effect on your body to deal with your reaction to stress. Wait, should I say that slower so you realize how insane this world is? Okay, and I'm not talking, Brandon, okay, although that's a thought in itself. Okay, people are giving toxic chemicals to deal with the stress response. That means high blood pressure, type 2 diabetes, most bowel disorders, sleep disorders, elevations in cholesterol. All of those things are not diseases. They're adaptations to chronic stress. Okay, and if you do not address the underlying stressor, but you give a chemical to deal with your response to that stress, is that dumb or dumber? Okay, yeah, it's pretty dumb. Okay, yeah. Now, also, when you're under stress, and this is any stress, physical, chemical, or emotional stress, your blood, which carries oxygen, which is vital to your immune system, which has to filter into every joint to create that synovial fluid, all of those things, the blood starts to get thick. It starts to get more viscosity. So does that mean and think of this, you're experiencing stress because you got a headache, okay, or you got any of the other stress responses, your blood becomes thick and they give you Advil, Tylenol, Motrin, a chemical to decrease your symptoms. Does that help thin your blood or does it thicken up further? Does it damage the kidneys like it says on the label? So can you see that that's an insane response? Water, because a lot of headaches come from dehydration. So drinking healthy amounts of water are a great idea. If you're a normal size guy and you're drinking 1.5 of these to 2 of those a day, that's a great idea. Headaches, drugs can give you a headache. This is called medication overuse headache. And this is out of the Journal of Head and Face Pain. What's interesting is there's a lot of drugs, okay, and that are out there, okay, and I know no one's ever heard of a negative effect of a drug, have you? Like, okay, Vioxx killed more people in Vietnam War, don't bring that up, okay, but there's always these drugs that are put on, approved, and taken away. Well, if you look at the effects of them, I know morons will call them side effects, but no, if hi, here's a cholesterol drug, it'll increase your risk of cancer, it'll actually damage your arteries, increase heart failure, and it does have a side effect of lowering cholesterol. Hi, here's an antidepressant. We call it a selective serotonin uptake inhibitor. We don't know really how that works, and we know the side effects are suicide and suicidality and suicidal thoughts. And it has the side effect of maybe making you happy for a little bit, but we're not quite sure which of those effects you're going to get. No, this is America. There is a couple of drugs, like one of them called Imitrex, that causes a rebound headache that is so bad that you got to take it again. Okay, I know this is a drug dealer's dream. Okay, so and it's one of the craziest ones. Okay, when I tell people, look, man, if you start taking cayenne supplements with each meal, it's a vasodilator. It'll get oxygen up to the brain. If you actually correct the curve in your neck and fix your stress load, you're going to go after the source of it. Or you take this toxic chemical that leads to more headaches. Medication-induced mitochondrial damage. Why? You see, I'm giving you the causes and solutions. Solution is never a toxic chemical. Medication-induced mitochondrial damage disease. So I'm talking every type of drug out there. Advil, Motrin, Aleve, nonsteroidal anti-inflammatories, okay, acetaminophen, statin medications, okay, and many others all damage mitochondria. Why is that important? Have you heard of headaches and migraines? Oh, wow. Those things that you get to treat it actually can cause it, but also bipolar, dementia, Alzheimer's, Parkinson's, diabetes, hepatitis C. These things damage your body's immune system, your mitochondria, which are the powerhouses of the cell. So do you want to take a chemical? Anybody think, that's why I started, anyone think that headaches come from lack of medication? No, that's foolishness. Then why would you go to a doctor that thinks that? Antidepressants and nonsteroidal anti-inflammatories linked to brain bleed risk. Bleeding inside of the brain is not good. Although antidepressants and nonsteroidal anti-inflammatories are known to be associated with an increased risk for abnormal gastrointestinal bleeding, now we're looking at an increase in intracranial hemorrhage. Again, that's not good. Deprescribing to reduce dementia. See, the average person over 60 has taken 12 prescriptions. I'm taking none, and I'm over 60. So somebody's making it up for me. The most I've ever seen in any human being coming into our clinic was 32 prescriptions. And honestly, and I'll tell people, look, make sure you're not taking two drugs together, because nobody knows what they're doing. Oh, my doctor didn't say that. I just take a handful every morning and it's just fine. Okay, well, take the medications that you're taking right now, okay, just for fun. Put the handful that you're going to take in the morning, put it in a petri dish, grind it up, bring it to the police department and say, somebody tried to slip me this last night. I want to see, is it poisonous or good? What do you think they're going to say? What do you think the police are going to say? Oh my God, the toxicology report came back. You could kill yourself by taking this. Okay, so we got to start deprescribing antihistamines linked to Alzheimer's. And people are saying, look, if I don't take that Tylenol PM, I'm never going to get any sleep. I need to take that Excedrin PM. That way I won't wake up with a headache. Okay, how would you like to wake up with brain damage? Because that's what's going to happen. Find the cause, find the cause. 93% come from the neck, find the problem in the neck and fix it. That's both blood analysis. The blood analysis on the top that looks like worms is called rouleau coin formation, where the cells are clumping together. The one on the bottom is a somewhat more normal sample. But when we're looking at this is a reverse curve in the neck with grade 3 arthritis. That means that this person had a whiplash trauma more than 20 years ago. Now you've got fluid that is produced in the brain called cerebral spinal fluid. This fluid flows from the choroid plexus in the brain down the spinal cord to give nutrients to it. If you have a reversal of the curve, do you think you have increased intracranial pressure? Absolutely. That's why we see a lot of people with a loss of curve, and you're seeing major cerebellar, which is the small brain on the back, dysfunction. Now, the brain is altered by alterations in nutrients, stimulus, and neurotoxins. So if you're not moving, now we had a 9-year-old kid in here with anxiety because her math teacher just really doesn't know how to teach. He would put a video up and say, learn from this. Okay? Math is exciting, man. You could have a teacher in there that just makes it come alive. But I said, okay, well, what do you do at recess? Okay, I'm coming from an era where every day we had gym class and every day we had recess. Okay, that's where you take 5 minutes to eat your lunch and 45 minutes to throw balls at each other. Okay, kickball and yeah, they don't have that anymore. They have gym class once a week. And I'm going, oh my God, you need movement for your brain. Okay, you want to have your brain working during the day. And I'm talking to the parent. I'm saying, can she ride her bike to school? To get that kind of movement. Okay, can you get in a group? Can you tell your friends, hey, look, we need to have movement for our brain. So, walk around she said, well, we have to stay 6 foot away from each other. Okay, what am I going to do? Tell this child the truth that her teacher's an idiot? So things that damage your nervous system and brain are bad. Things that help your nervous system and brain are good. Okay, that's it, basic. Vaccines create an inflammatory response, and we're not talking about the Voldemort shot, okay? That one's a gene-altering medical procedure with no long-term studies. Medications, MSG, glyphosate, pesticides, topical creams like Purell, sunscreen, things like that. There's already been a bunch of things out that talk about how Purell is cancer-causing and sunscreens are cancer-causing. And I think they were built by Johnson & Johnson or something like that. And there's baby powder that was toxic too. But don't worry, they nailed it on this shot. The shot's safe. Bullshit. Sorry. Okay. Neuroplasticity. Anything that regenerates your nerves is good. So movement, symmetrical, cross crawl. This is how we get our brains and bodies to do it. Healthy fats, exercise, aerobic, plant-based. Plant-based means the animals that you eat are healthy. Okay, but when you're in a stressed state, you can't break down the amino acids from the animal protein, so plants are better while you're recovering. Non-pharmaceutical, okay, now this is 2020, non-pharmaceutical measures for pandemic. This is the CDC. So the great gods, the fact checkers, okay? And so it's not me, it's the Center for Disease Control, and they are higher authority than the Pope. They say 10 different randomized clinical trials worldwide reviewing infectious respiratory virus transmission found no significant reduction in the transmission using face masks. Okay, let's look at the other one. A cluster of randomized cloth masks compared with medical masks in healthcare workers. This study is the first randomized controlled trial with cloth masks, and the results caution against using cloth masks. This is important to inform occupational or OSHA. Moisture retention, reuse of the cloth mask, poor filtration may result in increase in infection. Now, has anyone seen the blue masks? Okay, you realize that those aren't to prevent transmission, they're splash guards. So if you're working on something, you're not going to get big particles in, and you're not going to sneeze or cough on the patient. Okay, it says it doesn't prevent any viral transmission. Okay, but cover your nose, sir. How would you like to be with me, go in a store, and they say, cover your nose, sir? And I'm going, well, those things don't really work. Okay, it's driving me nuts. Headaches and the N95 mask. This is why I'm putting it up here. It's pertinent to the talk. And this is at Activa Neurologica Scandinavia, 2006. 10% of the healthcare workers in one experienced such severe symptoms that they were forced to take an average of 2 full days of sick leave from their healthcare jobs, while 60% of the healthcare workers were required to use abortive analgesics because of the headaches. So covering your face, rebreathing in your own waste can create stress. Headaches is one of them. Headaches associated with PPE, cross-sectional study on healthcare workers in headaches 2020. Study involving 159 healthcare workers, 21 to 35, found that 81% developed headaches from wearing a face mask. Okay, now, is this protecting your viral exposure, strengthening your immune system? And let's go again. Anything that helps your immune system is good. Anything that weakens your immune system, puts you in a stress state, gives you a headache, and puts you in a hypoxic state is bad. Okay? Migraines linked to heavy metals and mineral deficiencies. Remember, when you're in a chronic stress state, you produce less stomach acid. Less stomach acid means you can't absorb minerals. Eye strain headache. This is the coolest exercise ever. When you're studying and reading, okay, but you got to get through that chapter. You got to do it, but your eyes are hurting. You're looking at a computer. Has anyone ever done that, where you just got to tough it out? Now, the muscles, skeletal muscles, might take a couple hours, maybe a day to relax, okay? Your eyes can relax in seconds. So here's what you do. Don't do this when you're driving. You cover your eyes and cover it super, super dark so you can't see. This is a participatory thing. I know if you're holding the cell phone, just do one. Okay, but this is going to be cool. You're gonna like this. Okay, so cover your eyes, make it super, super dark. Now, leave your hands dark like this. Open your eyes, but keep it dark, and try and focus in to see the inside of your hands. Now that you're focusing and try and see the inside of your hands, your pupils are going to dilate, and you're going to feel this relaxing effect on your eyes. Now, if you maintain that darkness, okay, can you feel the relaxing effect? Yeah, isn't that a trip? It does really work. Okay, so the smooth muscles in your eyes, if you're doing this just for 30 seconds, it's going to relax and refresh it. Isn't that weird? Yeah. And so that has a calming effect. So if you got to get over eye strain real quick, it works really, really fast. You need it 30 seconds, 20 to 30 seconds, maybe a minute. And you could do that if you notice that, but it's great for the eye strain. Again, here we got reverse curve to normal curve. Now, when you're looking at this, when we do the x-rays, this hard part here is called the hard palate. Now, it can move 15 degrees up or down without affecting the curve of the neck. And that's just at the limit, the post x-ray of what I would accept. And that's a little bit high. So when we shoot our x-rays, I'm kind of on the picky side. Okay, very on the picky side. Okay, here's another one, before, after. So when we talk about regenerating, okay, correcting the curve, and people say it's not possible, it is possible. I mean, we've got to do post x-rays, and we'll do post x-rays in 2-3 weeks. Now, here's a couple of great things. One, if you have a dish towel, not a big heavy towel, and just pull down, but you're only pulling down with 2 pounds of pressure, and your hands are right tight to your chest, pulling down. And then you don't want to look back. You want to look up. And while you're looking up, you're pulling down with about 2 pounds of pressure. Then you look straight ahead and relax. Up, straight ahead, relax. Kind of like a turtle looking out of their shell. You can use a shirt if you don't mind destroying the collar. Okay, look up and straight ahead. That gives a pivot point and it hydrates the disc. Now the discs are 70% fluid. So just that little bit of movement is going to be ideal to hydrate the disc. Or you could do static. So like if you're sitting at a desk, you put your elbows on the counter, lift up and deep breathe. Deep breathing is the key on this because that's going to increase the intrathecal pressure and force fluid into the disc. Fantastic. If you do like this and you're laying on the table or floor, you might want to put a little pillow underneath your ankles because a lot of people, if they're sitting a lot throughout the day, they can't lay flat like that and get up without any back discomfort. Again, we're looking at before and after. I'm just putting these up to show you the difference. Now, this happens to be 2 Parkinson's patients in the middle and on the right. And you can see, remember, Parkinson's is from trauma, okay, causing an alteration in communication to the brain and causing the body to respond with movement, which the movement generates dopamine. But ultimately, it's loss of curve in the neck, pulling on the brainstem, altering those structures. And that's literally what we're going to see on 100% of people with Parkinson's. Cayenne capsaicin supplements. Do not take this on an empty stomach. Okay, you won't die, but you'll want to. Okay, when I first read about this like 15 years ago, we were experimenting around. Man, but this thing is, so if you don't like spicy foods, okay, that's cool. Take this with you, and it comes in capsule form with your meals. You're going to get hot, you're going to get sweaty, but it's loaded with vitamin C. It vasodilates, so it opens up the blood vessels and it thins the blood. Okay, so correcting the curve in the neck is one, but if you have a toxic or compromised stress state and your blood is thick, this will start to thin the blood and get it healthy. There's a really good book. I don't know if it's got to be out still. I mean, they've censored Gone with the Wind. Hopefully they didn't censor this one. It was called Left for Dead. Okay, but it was a failed bypass surgery, and it was just brilliant. I love that book. So correcting the problem and detoxing. Find the problem. If you have chronic headaches or migraines, find a doctor that can identify the problem and identify what percentage they can correct it. So this is why you do stress x-rays. Physical, you got to do a structural and neurologic correction once you find it. chemical. You could do oral chelation, IV chelation. I mean, this could be as simple as getting more cilantro on your salad and eating more organic veggies. Emotional, be aggressive on this, because if you can control your emotional state, you change the chemicals your brain secretes, and that alters your physiology. So look at our videos on how to reprogram the subconscious. Does that make sense? So you could take care of all of this. You just need to find a healthcare professional that understands to actually look for, identify, and correct the problem. This is why when we put up, you need healthy nerve supply. Okay, where's the main part? The brain. And this flows down through the spinal cord. So if there's an interruption or an alteration of that, you're in a stress state. Regular exercise. Like when we take this country back, man, we're going to put physical education back. We're going to put shop class back so these kids can play and have fun. Okay, we're going to look at other countries like Finland, who doesn't have a lot of homework, instead of our little kids that are tortured by sitting in a room trying to memorize and regurgitate, to turn them into little drones. No, we're going to get the exercise and play back. Kids got to play. Proper nutrition. We're going to change this monocrop poisonous culture. When we get people 500 miles either side of the Mississippi, we're seeing massive headaches and allergies and bowel disorders. I mean, it's horrible because the glyphosates, I mean, this mineral chelator and antibiotic is rampant. Okay, sufficient rest. How many people are getting good rest? Can you imagine anyone with a chronic disease anywhere saying, man, I slept good last night? No. Okay, and it's not prostates that's waking you up. It's not drinking too much water that's waking you up. It's you're breaking your circadian rhythm. Look at our sleep videos. And prayer and meditation. This puts you in a parasympathetic nervous system state. It puts you identifying with something greater than you. Does that make sense? Okay, now we're going to be changing into an area where in our current Ukrainian, I mean, in what are the Stalinistic? I mean, in American, wherever we are. So Kim Jong-il will actually, I mean, Brandon will approve of this stuff. You understand? We're in America. I'm having videos removed. I'm having my freedom of speech censored because what I'm telling you is dangerous. So YouTube and Facebook, God bless you. I'll see you next week. If you're on Dr. BVIP, you're going to see this uninterrupted. I just had to show you this because I don't think this is censorable. This is a hug tunnel. So if you want to go along with everything and have people be afraid of everything about you, and you want to live that boy in a bubble lifestyle, here you go. Marcus Cicero. The closer to collapse of an empire, the crazier its laws.